12 weeks since the onset of the novel coronavirus pandemic in the country, the Ministry of Health believes the country has learnt enough lessons and given it the confidence to try out managing the disease at community level. Triple-digit figures of new infections are becoming the new normal, 124 persons testing positive in the last 24 hours, pushing the total of infections to 2,340. The death toll now stands at 78, with 592 having recovered and discharged from hospital. The case burden is now at 1,670, a majority of whom show no symptoms.
It makes no business sense to be able to manage these people in a hospital facility. You can be able to manage them in a home-based isolation facility or a community-based isolation facility.
A lot of people who are in isolation facilities may be released to be taken care of at their homes, provided two things happen. A, it is in accordance with new World Health Organization protocols that we are still looking at and trying to customize and domesticate to our situation.
According to Ministry of Health statistics, 85% of all coronavirus cases reported in Kenya have shown no symptoms, with the balance showing majorly mild symptoms. Still, majority of COVID-19 patients are admitted at various isolation and treatment centers across the country. As of Wednesday this week, 846 patients had been admitted at 49 hospitals, with only 4 admitted in ICU facilities. Hospitals in Nairobi carrying the biggest burden, followed by Mombasa.
If this is implemented, it would free our health facilities from congestion. Because we are reaching, for example, in Nairobi, at a time when both Bagathi and KU are already getting to full status.
The Kenyatta University Teaching and Referral Hospital, which has a capacity to attend to COVID-19 patients of 456 beds, leads in hospital admissions nationally. As of Wednesday, 346 had been admitted, the number having risen further on Thursday. The Mbagathi Isolation and Treatment Center has a capacity of at least 112 beds, most of them taken over by patients with mild cases. Home-based care could significantly reduce the pressure on health facilities and leave them to attend to other ailments in the community.
I am appealing to all Kenyans, as soon as this protocol is out, that when we see people coming home, we will understand two things. They are no danger to us, and therefore, there is no need for stigmatization. But the people concerned will have to take care, and the families, you have to take care of them, so that they do not, because they do not need hospitalization.
Well, the ministry is yet to release the guidelines on home-based care. According to WHO protocols, COVID-19 patients recovering from home should isolate themselves in their own room. They should avoid unnecessary mingling with others, even at household level. For all items they use, they must ensure they are thoroughly washed with soap and water, while shared ablutions must be disinfected after every use. But this could be a challenge for communities where households don't have the luxury of multiple rooms and social distancing is a mirage.
And where families are not able to either self-quarantine or self-isolate, the government will still assist in the process.
When home-based care becomes a reality for COVID-19 patients, that will mean at least 80% of patients are potential candidates for such kind of treatment, given that they have shown no symptoms. Speaking in current terms, where over 1,600 are active cases, that would mean that about 1,300 can be released to their families to recover from home. Sam Gituku, TV, Nairobi.